Hi, I'm Dr. Jay Harness with Breast Cancer Answers. One of the important questions that I'm asked by my patients is, hey, Dr. Harness, what's the likelihood that my cancer is going to recur? Well, before answering that important question, let me take this opportunity to thank our sponsor, Breast Cancer Index. It's a test that may help women with estrogen receptor positive early stage breast cancer decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. Well, before answering the question about recurrence, we need to define the kinds of recurrences you can have. One recurrence can be if you've had a lumpectomy in what we call an ipsilateral recurrence. In other words, an in-breast recurrence in the breast originally treated. And depending on the initial stage and the biology of your cancer, in general, that's roughly about 1% per year. That's assuming that you had the adequate lumpectomy, negative margins, whole breast or other forms of radiation therapy, the appropriate anti-hormone therapy. If you needed chemotherapy, you had it. That's what I'm presuming and giving you that sort of 1% per year recurrence rate when it comes to invasive breast cancers in the treated breast. If you've had a mastectomy, there's also a chance that the cancer can reoccur at the mastectomy site. And to help prevent that, radiation therapy can be added if you particularly have a really locally advanced breast cancer and have had a mastectomy for that. You probably have had chemotherapy, anti-hormone therapy, obviously surgery that's well done, negative margins, the appropriate lymph nodes have been removed, and what have you. In general, the chance that you're going to have a mastectomy site recurrence is under 5%. It can run 5, 6, 7% sometimes. Again, this is all dependent on the biology of the cancer. So after both lumpectomy and mastectomy, you could have a recurrence at the local treatment site. And those are called local regional recurrences. And you could also have a recurrence within your lymph nodes, which again is all part of local regional recurrence. Now, the other form of recurrence is called systemic recurrence, meaning your cancer has reoccurred in places like your liver, your bones, brain, lungs, places of that sort. The odds of that happening, again, are really dependent on the initial stage of your cancer, the initial biology of your cancer, a variety of factors. So it's really hard to give a number. But in general, stage 1 breast cancer patients should be doing well after 5 years into the 90% plus range. In general, stage 2 patients are in the 80% plus range. Stage 3 patients, again, depending on the biology, you may be down in the 60-some% range. The difficulty with trying to predict those kinds of recurrences is the numbers I'm sharing with you are based on historic information, and obviously our treatments are all evolving, thank goodness, and evolving to the better as we progress through time. So remember, there are different kinds of recurrences, local regional recurrence as well as systemic recurrence. Work with your local breast cancer surgeons, your medical oncologists, radiation oncologists, to see if they can help you understand what your odds of a local recurrence are. And if you're on anti-hormone therapy, you're also going to want to know if prolonging the anti-hormone therapy is going to be important in your case. As I end this heartfelt video, I want to once again take this opportunity to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.